tax deferred. If you put $3,000, like the Trump administration is talking about, into one of these accounts, these are pre-tax money that you can actually invest. And so those that tend to actually utilize them are those that have disposable cash. As you pointed out here, those that have higher incomes utilize them. Those that have incomes that force them essentially to buy insurance on the ACA marketplace do not use them. They don't have disposable cash. So HSAs are not are regressive. They do not actually benefit those that need them the most from an income standpoint. That's one. Two, that's exactly what Republicans are talking about. Let's just send people checks, $2,000, and assume that that's going to cover catastrophic care, which it will not. This is not comprehensive health care. It's not an alternative for actual meaningful healthcare reform. That's the hard work of statutory law and actually doing something about these subsidies, which is what actually a bipartisan group of members in the House are suggesting they're going to do come January and the end of the recess, put forward a vote and do a temporary extension of the subsidies and force the hand of the Senate. Senator Thune, the majority leader, said he's not going to actually support that. So where are we? We're not in a place, and just to talk about it for your audience here, we're not in a place where real solutions are being talked about for prices. The reason we have a health insurance problem here in the US is because we pay the highest prices for hospital care, for drugs. We're making some headway on drugs with Medicare drug price negotiation. The prices are the big problem. You're not hearing anything about price reduction really at scale. Underinsurance, we just talked about it, driven by high deductible health plans. We should be moving towards making sure people across the country have chronic disease management coverage that is pre-deductible. Make sure they have it. Make sure that care does not actually have to go towards one's deductible, so that everybody has preventive screening and basic care. And then really gaps in coverage. Employer-sponsored health plans have gaps in coverage. That's where we need the public option. For Medicare, we need the 10 states that didn't expand Medicaid to be serious. Their people actually want Medicaid and benefit from it. We aren't hearing these actual solutions here across these dimensions.